Trigger warning. This episode of the Spartan Nurse Podcast contains triggering content around the topic of mental health and suicide. Please feel free to take the space you need. Skip this episode and focus on self-care in celebration of World Mental Health Day.
If you or someone you know is struggling with mental health, remember you're not alone. Please reach out to an available resource for help. We've listed some of those resources in the description below.
Trigger warning. This poem was meant to be funny. I tried to think funny, be funny, channel my inner comedian, write funny across a blank page, funny. Like that time I broke my arm running from a squirrel, true story. Funny, I thought it was chasing me, funny, it really wasn't funny. I still believe the squirrel apocalypse is a thing, funny. Like that time a boy called me fat. When I told him I thought he was cute. I kept the joke going. Kept his homeboys laughing, kept my waistline expanding inside the punchline, hoping they wouldn't notice it wasn't funny. Like that time I lost my wallet. I found myself at the grocery store, cart full of baby formula, funny, the nice lady paid, funny. I really didn't lose my wallet, funny. I didn't have enough money to fill my car and my child's belly, funny how life is. Keep writing, you will get to funny. Keep laughing, laughter is the only thing that will make this poem funny. Like that time I wrote my first haiku along the wall of my college dorm, funny. It was actually a suicide note. Funny, no one noticed. They say the ones that laugh the most, laugh the least. Robin Williams, Anthony Bourdain, my cousin, me. They say laughter is the best medicine. If I keep laughing, maybe I'll be cured. If I keep writing, maybe I'll be cured. After all, what do you say to God halfway through a poem or a prayer or a punchline or a suicide note? Funny?
Wow, just so powerful. Like moving. I think a lot of times people live with things and they deal with things and we don't even know it. Really, wow, so awesome.
I think it hit a lot of personal insecurities because a lot of my life has been being the happy person, being the happy-go-lucky person, being the person that other people needs, but not being able to express what I need, not being able to be the person that I need for myself, just to be there for everybody else. And I think that was one of the most powerful poems I've heard in a long time.
How much do I love you right now? Thank you. Thank you. I actually intended that poem to be funny at the start.
And
it just kind of took a dive. And it just kind of spiraled from there. People don't often think about how their experience connect and how they present themselves, as you grow older and what it looks like. And that was how all those experiences kind of connected to that space where, I feel alone. I feel exhausted. I feel unsupported. What do I do with this?
Well, and I think it also brings a good analogy to physical health being just as important as mental health. Yes. Because if you break a bone, you obviously have to let it heal and take time for it to heal. But people don't often think about the fact that when you have mental health and mental health crises, you have to take time for yourself to really heal, whatever way that looks like. Yeah. People get so discouraged with that because they just don't understand because our society doesn't talk about that.
Come on, you better come through. It's also a pain you can't touch.
It is.
Yeah.
I think stigma is such a big thing. I used to work at a psychiatric hospital, and I would do groups with patients. And one of the things that they said was one of their most stressful things is stigma, and that stigma of mental illness, and it prevented them from seeking the care that they need and all kinds of things. And I think that this poem really speaks to, people have things going on the inside, and you need to be able to talk about those things and to seek help for things. And it really raises awareness about that. So really powerful.
Made me cry.
As you should. Crying is okay.
Today we are honored to introduce Kelly Native Child Brown Mays, a seasoned professional with a diverse skill set and a passion for making a difference. As a therapist, writer, and social activist, she has dedicated her career to advocating for mental health and equity. Kelly currently serves as the Community and Staff Training Program Manager at Hegira Health, where her responsibilities extend to overseeing the development and implementation of staff training plans for a team of over 400 professionals. In addition to her work within the organization, Kelly is pivotal in facilitating advocacy and engagement training and collaborates with statewide agencies to address pressing health inequities. Her commitment to suicide prevention programming has led to significant resource expansion within Hegira Health.
Kelly is not only confined to her professional role, but also has a dynamic media presence. She has made impactful appearances on television, radio, and print media, and has directed compelling public service announcements, PSAs. Her outstanding contributions to mental health advocacy has earned her recognition, including being honored as one of Crane Detroit's 2023 most notable leaders in behavioral health care. Kelly Mays' career is a testament to her dedication to fostering positive change in her field and community, making her an inspirational figure in mental health and social activism.
We would like to welcome the audience to the special World Mental Health Day episode of the Spartan Nurse Podcast. So, mental health affects virtually everyone. Whether it affects you personally or somebody that you love, it affects everyone, and it affects everyone in different ways. So today we're here to spread awareness on this important topic. People that are seeking mental health care have lots of barriers in the way to seeking mental health care. So we know that some of those are stigma, some of those are access to care, some of those are discrimination and social issues as well. So there's lots of different barriers to someone seeking mental health care. And, one of the things globally is, looking at ways to address those barriers and really break down those walls and those barriers that exist. So hopefully during our interview today, we can kind of talk about some of those things as well.
And address not only the patriarchy and its role in it, but also sexism, racism, homophobia, transphobia, and all other kinds of phobias that kind of play into mental health care as well. So Kelly, I have a good question for you. How can we address the fact that only 1 in 4 people globally will need mental health care in their lives?
That's a big question. I think the first thing is, as you alluded to, is access to care. But there's different parts of access to care, and what that looks like will depend on the community. So here in Michigan, we have a lot of pockets of rural communities. And the further you go up in the UP, the less likelihood that you might find maybe a psychiatrist who has a specialty in, say, in youth. And there might be just one psychiatrist for hundreds and hundreds of miles. And I talk a little bit about this when I'm doing a lot of my suicide prevention work, and how one of the unique consequences of the pandemic was the rules as far as telehealth were relaxed, and how someone might spend a whole day, take off work, drive for an hour or two just to get access to see a psychiatrist for a 15-minute med review, and then have to go back and hope that the medication is available, or they might have to wait for medication. And so telehealth made that, that barrier, a little more doable. The problem is post-pandemic, post-apocalypse, is that the insurance companies now are tightening up the parameters as far as the access as far as telehealth is concerned, which I think is a bad idea. And also, too, a lot of people are leaving the field, and so they don't have access to a provider or a therapist or a clinician. I think the other, when you're talking about access to someone who is properly trained. So we have trauma-informed therapists. We have therapists who maybe, like myself, my specialty is suicidology. That's my wheelhouse. People who are trained in DBT, people who are trained in dialectical behavioral therapy, people who have backgrounds in cognitive behavioral therapy. Those type of things where, you're trained, you have extensive training, and you go through internships, you have a supervisor who helps support you, throughout that training. Those type of people, are few and far between. And so when we talk about access, we have to look at, because people think, oh, there's a facility, close by, and they think access that way. But there's so many things that come under that umbrella.
And it's important that you mentioned like the UP, because I had a friend who was going to school up there, 2 friends actually, and both of them had an incredibly hard time to find a regular therapist to go to. And I remember their frustrations and their struggles to the point where they had to give up because there was just nobody available to help them. Eventually, the pandemic made it so they could get services, but it was still like, it's embarrassing to even think about the fact that there's such a giant gap there in healthcare itself in America, that somebody who desperately needs care had to wait for a global pandemic to get the care that they needed.
Wow, right? And if you think about the state of Michigan, like we have like some amazing facilities, that are very future thinking. And, we have all these hospitals and all these care, and yet we have these pockets of our communities that don't have access to this care, which contributes, to the disparities. And it's unfortunate. It's only one me though. I wish I could learn how to clone me, and I would send me throughout my state. There'd be little me's everywhere, helping support people.
I know. I wish I could clone you.
That'd be great, right? I was dealing with some anxiety issues myself, and when I was referred to, go, have a therapist or speak to a therapist, and I was told by multiple people it'd take months to get in, right? And that's just something that I've experienced personally, but I've seen that in our patients a lot. I worked in the ER and the emergency room, and we had a lot of behavioral health hold patients, and I always wondered as an ER nurse, what barriers did they have to their care? What things that led them to that crisis mode? Because we would see them when they were in crisis mode, right? But what led to that, and what could have stopped that chain and that stress continuum before it progressed? And we would see them in the ER as those hold patients waiting for a bed out in the community. But what led to them being in there? What could have been prevented to even prevent that hospitalization in the first place? So I think that this is really important that we're discussing these things.
Yeah, statistically, there's 54% of adults who don't receive treatment for their mental health illness, who need treatment. And then for those who do receive treatment, there is an estimated 11-year gap between symptoms onset and the first treatment, meaning like they struggle, and then we're talking about from the point that they get treatment to the point where they're in maintenance space. Oftentimes, people have relapses and they're not supported, or they have crises, and from the time that they leave the hospital to the time that they see their first appointment with their provider, there's that time in between where they're not supported.
Absolutely, and they can feel alone.
Yes,
there. Yeah,
absolutely. Yeah.
Well, and if we think about it, it's not even just a uniquely American issue.
It is not.
Globally, it's so taboo to talk about. Like, I think America has come small steps forward in it.
Very small.
Very small. But considering the fact that there are some countries where you don't even talk about that or address it, it's very disheartening to think about sometimes.
Absolutely. I work with, oftentimes I work with people who are first generation Americans. They, their parents came over and they were born here. And they talk a lot, and I see them in my offices, and they talk a lot about, well, I don't talk about my anxiety with my parents, or I don't talk about my ADHD, with my cousins, because I don't want them to think, this, or it's taboo. And I'm the type of person, I'm very transparent. I was diagnosed with bipolar disorder when I was 14. And this was like in the late 80s, where they didn't have any kind of treatment for teenagers with bipolar diagnosis, like nothing. Like they literally played spin the bottle on my medication. And it wasn't until my late 20s, early 30s that I got onto a medication that worked. Thankfully, I've been on maintenance medication for the last 10 years, and I tell people, like, this for me is norm. Well, but for others, I have a Baptist, maybe she rests in peace. I have a Baptist grandmother, who used to tell, in one of my poems, I talk about, she used to say, oh, take her to church. You just need to pray over her. You know, like, I have a mood disorder, grandma. Like, there's not enough praying in the world. I'll take your prayers, but I also want to take my medication. But yeah, having that conversation and normalizing that within family units is so important and can be really impactful.
Yeah, and not making you feel like just because you have a mental illness that you're broken or that you're damaged by some cause, that, you know, just like medical illnesses, mental illnesses can be treated, and you know, those chemical imbalances can be treated. And I think that that's a big thing is sometimes people are make other people feel that way, that they're kind of broken or damaged type thing.
Yes.
But if we also think about it, it's a holistic approach. Because we can't just pray over an issue. You have to have outside factors to help that. Yeah. Some people, they can pray over an issue and they can feel better, but some, there's a different challenge in front of them where they need something to make it equitable, like a stepladder, to overcome that mental roadblock.
Absolutely, absolutely. Not that I didn't love praying with my grandmother, and she made the best hush puppies in the whole wide world. But that didn't help me when I was manic, you know, or when I was suicidal. It didn't help. It helped afterwards, you know, because I was thankful to have access. I had an amazing mom who was very supportive, who struggled with depression herself, you know, so she got it, And, but for her support, I probably would have taken a little longer, you know, to get to that space where I was safe. I had an amazing therapist too when I was 14. She looked like Pat Benatar. I love Pat Benatar. I'm obsessed with Pat Benatar. And she just like made me feel safe, and safe enough to talk about these things that I was feeling on the inside that no one could touch, you know, or that I couldn't name. And I thought that was like the beginning of why I wanted to be a therapist.
But I also wonder, did she also make you feel seen? Because I know with my personal therapist, he is a queer man. And I have never had that kind of therapist before. It's such a different relationship and dynamic where I'm like, oh my gosh, you get me. I'm not talking to this random straight person that's not understanding, like, and I'm going to get personal here, but like dating for me is quite different than my straight counterparts. Like, it's not going to be as narrow of a road because queerness is still not widely accepted in America. And there's still various barriers in that. And I know we've talked, and my therapist and I have talked a lot about that and anxieties of being queer. Then he gets it, versus when I've had therapists who are straight that are like, well, just live and be yourself. Why are you scared? And I'm like, you don't understand what I'm saying to you, though.
Yes. I think that's also another layer to the access to care is having a culturally responsive therapist, but also having, you know, it's okay to try to find a therapist who looks like you, who understands. I mean, seriously, you know, I'm Afro-Indigenous. I was born, you know, my father is a member of the Saginaw Chippewa tribe. I'm a member of the Saginaw Chippewa tribe. My mother is African-American, you know, and oftentimes, you know, I do work with youth who are also mixed race, and they're like, you get it. I don't have to go and explain anything. We don't have to start from, you know, from one. We're already there. We're already at 10, so we can start the work there. And so for you to have a therapist who gets it, where you don't have to go back and explain, you don't have to get on the Freudian couch and, you know, and talk about your childhood. They get you. You're already there at 10. So like sometimes you might want to talk about the lady in front of you at Starbucks, you know, who took too long to order her pumpkin spice, you know,
right.
You know, and then another time you might want to talk about your anxiety, you know, but they're there already. They get it.
So considering the fact there are 43 million Americans that are currently facing mental health challenges, what steps can we take as a nation to really improve that kind of care holistically and also just educationally, I think, is a better way to really approach that kind of care?
So I'm gonna speak from a couple of different viewpoints. The first is research. I don't think that our research is for future thinking. And I'm gonna just speak specifically about suicide prevention, right? So pre-pandemic, they saw the suicide rates were starting to go down. During the pandemic, the suicide rates continued to go down. Now, if we look at certain populations, those suicide rates are still decreasing, but in certain populations, they're increasing. And if you look at intersectionality, you know, and addressing that in certain populations, still increasing. The problem is, you know, 10 years ago, they were doing research for white males, over a certain age, to gear the suicide prevention efforts towards them. And again, they still make up a majority of the suicide deaths. However, there are other populations where they're increasing and there's not enough research. And I think that that's a huge thing. We need to be doing research. We need to be figuring out what works, what populations, like their protective factors, looking at things that are specific to those populations and addressing intersectionality. Huge. The other thing, when we talked about this stigma, normalizing language, and just having conversations, especially having programs that support youth, especially on college campuses. We have when I went to Oakland University, and I'm not knocking Oakland University, great place, but the only support that I had was like a peer counselor who really didn't know much. I'm talking about my history of suicide, and so they hear suicide, and all of a sudden they're calling 911. I wasn't suicidal. I was just sharing with them my history. So having access and having programs where you're teaching and you're supporting people who are already there with diagnosis, not just like, and just starting from there and also asking them questions like, what are your needs? What are your needs?
Well, and if you think about it, I think just from speaking from a queer lens and from my community, talking about the transgender suicide, it's 8 times more than the average cis person, cisgender for those who are unfamiliar with that term. And I think it's so important that A, there's not enough research done around it. Yes. B, it's a holistic issue where there's not acceptance. There's not acceptance from home life, society, healthcare, where there's so many things at play, and we're not doing enough research on how to accept, how to really come together holistically to support this community.
Yes. I think it gets pushed off to specialized nonprofits or grassroots organizations. You have like the Ruth Ellis Center in Detroit, but it shouldn't just be the Ruth Ellis Center, holding everything on their shoulders. These are programs that should be expanded, into all spaces. Trans people don't just live at the Ruth Ellis Center in Detroit, right. And so we should be having conversations. How can we support the community? What does mental health care look like? How do we integrate mental health care with primary care? There's so much that needs to be done when in that umbrella space of research, and we're not doing it.
Yes.
And that research really will help guide, any kind of healthcare providers when they're working with patients to help give them some guidance, because especially for some of those groups that we identified, right? Because, they have unique needs in those groups and there's unique challenges, and to not have that research out there and not have that support out there, they won't know how to make those decisions and how to, help support those individuals the best way that they can.
Absolutely. I think too, for workplace, there should be more workplace initiatives. And I'm not knocking EAP programs. I love EAP programs. I think that because they're solution focused, that oftentimes they don't address the things that are needed to be addressed. Because if you look at the EAP programs, the therapists there, either they're therapists or case managers, they're only allotted a couple of sessions, and then you refer out. And it can be really difficult to meet with someone a couple of sessions and then get referred out and then have to start the process all over with a new provider. It can be very frustrating. And then when we talk about turnover, I've had clients who have come in and I'm maybe their 6th or 7th therapist in a year. And they're like, okay, where do you want me to start? And oftentimes what I tell them, I'm like, where you want to start? And they'll say, well, you read my chart. And I was like, well, actually, I didn't read your chart. I prefer, and I know that's not best practices, but I prefer to meet someone, talk with them first, and then review their chart. Just because I want them to start where they want to start. I want to center them. I want to make sure that they are the experts in their life, and I'm not an expert just because I read some words on a document. But I think that we need to explore what kind of workplace initiatives can help support, especially trans people, because they really struggle in the workplace. I had a friend of mine, she just recently passed, and so she went to work one day as one person, and then came back the next day as another person. So it was, and I don't want to use her name, And so she came to work male one day and transitioned the next day. They fired her. And this was in the late 80s. She talked about that impact, like losing her insurance, losing that those work besties, all those different things that people don't think about because of their own prejudices and how that impacts people's lives. And I think that there should be more support.
There needs to be more support.
Yeah, that's traumatic. Going through that is traumatic.
It is. Because you're who you are. You want to come who you are.
Not to mention, I don't want to speak for them, but a lot of those who are transgender end up losing their families because of who they are.
Yes, absolutely.
Because sometimes they just don't understand that that's who they are.
Absolutely.
And I feel that sometimes you're talking about the employee services. Sometimes, some of these things will help with somebody's in crisis, but a lot of times I think we need to put a lot of focus on before they get to the crisis mode, right?
Yes.
And I think a lot of even these public programs are focused on, okay, they're in crisis mode on that stress continuum. It'd be nice to, in that striving stage, to kind of look at some of those things that to keep people well, to keep people doing, those things I think are important.
Absolutely. And can we talk about the toxic work self-care? Granted, I tell people all the time, self-care. But also think about someone who's struggling with a diagnosis. Self-care might look different. Getting up and just brushing your teeth, which is self-care, might be an accomplishment for someone who is struggling with depression. Or leaving outside to check your mail can be self-care for someone who's struggling with anxiety. And I think that we throw the word around so much, like self-care is for someone who is thriving, but needs to step back when they're feeling stress. And just defining that, and it's such a thrown around word, and I think people need to understand that self-care looks different for different people. Yeah.
Absolutely. Good. So what are some solutions or policy changes that you could see that would help improve mental health?
Paying for it.
Okay.
Covering the cost of it. I do have private pay clients. And they pay a lot of money because, and it's connected to like stigma. They don't want anyone to know they're in care. So they pay privately. They pay out of their pockets. Honestly think that mental health care should be something universal, just like free lunch, which they're finally doing here in Michigan. Thank you, Michigan. Thank you, Governor. But I think it should be something that's universal. It should be something that's provided for everybody. They should be able, just like you have the wellness care from your primary care doctor, you should also be able to have wellness care from a mental health therapist. Check-ins, and something that's overused, but I use a lot, that whole check-in with your strong friends thing. I think we need to dismantle what wellness looks like in our bodies as far as mental health care. We need to take that away and start building up, because wellness in different communities looks different. And I think that we're stressed and we're pressured to kind of look like our neighbors because they're doing well, right? So I should look like them, but absolutely not. Yeah. I think one of the other things too is when we look at parents and how parents respond and support their children who are struggling, they need support. Caregivers, there's a lot of fatigue that comes along with someone who is helping manage someone or support someone with a diagnosis. And I don't think we have enough programs for that. Depending on the diagnosis, there's a lot of support for people on the spectrum, or for caregivers who are providing for people on the spectrum, depending on the age, I should say. Let me preface that. Not enough support, but there's support. But someone who is struggling, or someone who is a caregiver of someone with schizophrenia or schizoaffective disorder, where's that support at? It's very few and far in between. Someone who is struggling with someone who has borderline personality disorder, which can be very intense. Mm-hmm. The support for that, you have to literally go Google, and hunt down support groups. Yeah.
I think that's great. I think, as far as, parents and kids is concerned, is, identifying, issues that maybe their child is in distress too, or maybe that they need to seek some further healthcare, that they need to speak some mental health care. I think that that's important. And also, I will say, as faculty here in the College of Nursing, I try to look for ways to identify that my students are going through a tough time. And I sometimes am challenged for that, but I try to look at different ways to see, hey, you know what, maybe somebody was coming to class and now all of a sudden they're not coming to class, or maybe there's some little subtle things, or maybe they're not eating their lunch. There's different signs that I've looked for, and I think that would be a good opportunity too. But I love what you said about the parents and their children having more resources for those other diagnoses that we may not necessarily see a lot of resources typically centered around.
Absolutely. It's statistically the highest rates of suicide are physicians. People don't know that. Yeah. Nursing is a hard profession. And nursing school is not an easy task, but having more support, being more, I think too, also having role models or people who are visible, who are talking about, their journey, their mental wellness journey, can be really helpful as well.
So you talked a little bit and alluded to youth depression and rates.
Yeah.
So we've seen an incline for mental health in youth, specifically depression, climb from roughly 6% to 8% since 2012, which is alarming. What do you think is causing this increase? I know I could say with my social media cap and doing a lot of research around social media in my undergrad, social media definitely plays into this. But what can parents, educators, and healthcare professionals really do to combat this?
The pandemic already exacerbated things that were already present, right? And so we already have the top 3 diagnoses that youth struggle with. There are ADHD, anxiety, and depression, right? And oftentimes, especially with ADHD, you'll hear, oh, that diagnosis is inaccurate, or you hear a lot about overdiagnosis, or it's just hormones, or, they're just a handful. With anxiety, it's like, oh, they just need to get around more people. Depression, it's hormones. They're just moody. And I think that having an understanding first of what these diagnoses mean and that they look differently in different bodies, especially like a 3-year-old who's anxious might look different from a 13-year-old that's anxious, might look different from a freshman in college who's anxious. And understanding that, that parents can also exacerbate their littles with their own anxiousness. So, like I said, I have a bipolar diagnosis. I also have an ADHD diagnosis, right? So do both of my daughters. And oftentimes, if you talk about ADHD, it's on a spectrum, right? You have your hyperactivity, you have your distractibility, you have your mixed type. I'm very hyperactive, if you can't tell. My daughter, my oldest daughter, is a distractible type, and she laughs when I use this comparison. But have you seen the movie Up?
Yes.
Mm-hmm. And the dog is like, squirrel. That's my daughter. She is instantly distracted. We have landmines of half drink bottled water all over the house, and we know who they belong to. My other daughter is the mixed type, so I get anxious watching them with their ADHD diagnosis and all the symptoms. So I get anxious when my daughter is distracted because I'm thinking, oh my God, did she drive distracted? When my other daughter, is so hyperactive, you're like, are people judging her because she's hyperactive? And then the fact that, my oldest daughter decides not to take medication. My youngest daughter does take medication, as do I. I think what is the impact of her long-term taking this medication? What is the impact of my oldest daughter because she's studying to be a radiologist? How does that impact her, in her studies? And I think talking to parents about what is their history, their mental wellness history and their mental wellness journey and how that impacts their children can be really helpful with their children, supporting their children. But I also think educators, you need to talk to them about how their mental wellness journey translates into the classroom because they might be anxious. They might have ADHD and that how that translates. Are they taking medication? And how other people in their classroom, all those distractions translates into how they teach or how they support their youth in their classrooms.
No, and as somebody with ADHD whose parents really didn't buy it, I know how challenging it can be. Like, my family wouldn't really talk about it at school, or I would have to I would just have to mask a lot because I'm a combination type too, where I'm like, I can be really hyperactive or I can be really distractible. Like, it just depends on the day for me. And that's one of the things where I had to mask a lot, and it put so much pressure on me. I was always so anxious, and even with the medications that I was taking, it wasn't as effective because I had to mask. Like, I couldn't express, like, this wasn't working for me. Like, these medications aren't balanced enough for me and my needs right now. And I know the need to succeed and to do that, because I was raised by my grandparents, which are from the boomer generation, where this isn't talked about, where ADHD wasn't a thing, in air quotes. So it was quite a challenge for me and my then doctor, for them to understand that, no, this is a real thing that is affecting me.
Absolutely.
Yeah, that really resonates with me too. I thought I had anxiety for years, and probably about 6 months ago, I actually got diagnosed with ADD and ADHD and started taking medications for that, and realized that that was actually the source of a lot of my anxiety. And I think that, and a lot of times, for me, I'd kind of put it off because I had a lot of workarounds. I'd work around things professionally, in school. I had my doctorate. I earned my doctorate with this, but it was a challenge, and it was a distraction. And I will say that, once I accepted that, hey, you know what, I need some additional help, that this is maybe more than just anxiety, and I sought help for that, it's really brought a lot of clarity to my life, and I can really see that. But I can definitely see, growing up, ADHD and ADD wasn't really talked about as a thing. So I just struggled with it in school for years, and didn't really, it wasn't really talked about, and was kind of dismissed as, whatever. And now as an adult, now that I'm on this, I'm like, wow, where has this been my whole life? I should have been treated my whole life.
You got to think, like, a lot of, even though the onset of symptoms start at a young age, a lot of people aren't diagnosed until they're adults. And even with that, there's a lot of advocacy that has to go along with it. I've sat in med reviews with clients, with their parents and youth, and had to really advocate hard, because the youth, the teenagers, like, well, the psychiatrist isn't listening to me. Like, this medication isn't working. And you sit there and you're listening to the psychiatrist, and like, yeah, we're going to just, they write the script. And there's some really amazing psychiatrists out there. I'm not knocking psychiatrists. But they don't listen because they have 15 minutes and then they have to move on to the next client. So I empower and I teach a lot of my youth clients, that it's okay for you to say this isn't working. It's okay for you to tell your mom and dad, like, I'm struggling, or that this medication is making things worse, or maybe we should look at, some medication to help these symptoms, so that I can, do things like school and homework and socialize.
So can you tell me a little bit about any initiatives that are currently going on, and approaches to improving access for all?
So for the state of Michigan, there is a push to support mental health services in men. So there's this website called it's Man Therapy, and it's geared towards giving language that is for men, provided by men. The only gap, I know they're trying to do more inclusive programming. So people in the SOGI community, people of color, messaging. There's also programming for youth that's just starting to make, you could see the impact of it. However, again, when we talk about intersectionality, are these programs impacting or getting towards youth in rural communities? Are these programs messaging going towards youth of color? I think that's a huge gap. What I've seen is there a lot of grassroots organizations create these programs that help support youth. I have a program now that I'm working on where I'm infusing art therapy and poetry to teach suicide prevention. So they can use poetry or art to create protective factors or to talk about warning signs of suicide. And I think that going from that space and being a little more creative, using things like TikTok, in sessions. I use TikTok in sessions. I do. And youth love it. Like, let's talk about your mood today. Did you bring a TikTok video to tell me about your mood or about your last week? And they love it. They love it. Like, okay, Miss Kelly, I was feeling a couple of different things, and they'll show me a couple of different TikToks and we'll talk about it. But also being creative in sessions, but also training therapists and saying like, hey, being a social worker, being a licensed therapist, being a nurse practitioner that specializes in mental health is okay. We need more of you. And then paying for it. School is expensive. I got student loans,
Yeah, me too. Oh yeah, let's not talk about those.
I mean, my mom is 74 and just had her student loans discharged because she's disabled now. 74. Wow. 74. I still have a few years, and I'm like, oh my God, I'm going to be getting Social Security checks and paying still student loans, but paying for that. Also, increasing the amount of doctors that we have that provide medication that specialize in youth. There's so many things, but there are programs that are trying to move that forward.
Right.
So, Mike, you've talked a lot about how you have different kinds of methods to work with your students here at the College of Nursing. What is the role of nurses, though, in mental health care?
Yeah, so I would say the role of nurses in mental health care. So first off, no matter what area of nursing you're in, your mental health is important. So no matter what area of nursing that you go into, what specialty area, whether you're in actual mental health or you're, a med-surg nurse or an ICU nurse, mental health is so important. And we need to, when we're taking care of patients holistically, we need to identify that, yes, mental health concerns really relate to physical health concerns, and physical health concerns also can relate to mental health concerns, and really looking at that. And so one thing that we do in the classroom is we really try to, we do a wellness intervention every day. So we do like mindfulness, deep breathing, some of those things we actually bring up. We show the stress continuum to help them self-reflect and determine where they are. And then so this is for our students to kind of see the importance of these things. So that way when they go out there as nurses into the community and they're caring for patients, they can provide self-care to themselves and work on their own resilience, because as nurses, it's a very stressful profession, right? Yeah. And then they can also implement some of those things with their patients. So maybe their patient's going to a procedure and, like maybe an MRI, and it's, there's a lot of anxiety there. It's a really closed in space. Yeah. And if you're already somebody that's suffering from anxiety and you're really nervous about this, there's things like, deep breathing, guided imagery, all those things that can kind of help that person cope with that stressor that's going on. And so I think that it's important for nurses to know these things, not only for themselves, but also when they're treating patients, so they can kind of incorporate this into the care that they provide every day.
I have a friend who does comic book therapy with her clients, and they bring in a comic book and that most aligns to who they are, and they follow the journey of these characters, to talk about emotions and to process trauma. And I was like, wow, that's amazing. Really? Yeah. I also have another friend who does video game therapy, and they sit and they play video games, and they use the video games to help, have conversations about their diagnosis. And it's like, wow, you guys are making me look bad.
And it helps them to express themselves, right?
Yes.
So it helps with expression, because sometimes people have trouble expressing how they feel, right?
They do.
So I like that. And I think one other thing that we also do that I was thinking as we were talking is we also provide resources and let them know what resources are out there and available and accessible, right? Because it has to be available and accessible, and making sure that the nurses are aware of that, the nursing students are aware of that for themselves, right? But also as they're providing care for their patients, what resources. And when, as nurses, we wear a lot of hats, right? And one of them kind of as therapists. We're not licensed, but what happens is we as nurses need to know our limits.
Yes.
Okay.
Yes.
And when we determine that somebody's in that crisis mode, we can be there for support. We can be there to listen, but we're also there to connect them with the right resources. When you were talking earlier about the right resources, the right people that know the correct things to do, I think that's really important, because it is important when somebody's in crisis. What you say is very important.
It is.
And what you don't say is very important. So I think that nurses need to be aware of their limitations. And we always are kind of talking to our students about, you know what, as a nurse, you may feel like a therapist sometimes, but we're not actually a therapist. So then we need to know when to collaborate with some of our other professions to get the patient the right help, or to get that individual the right help that they need at the right time. Yeah. So Kelly, can you share with us your perspective of the role of healthcare professionals in addressing mental health?
As a licensed therapist, I think that one, we need to be transparent about what therapy is, because there's a lot of misconceptions about what therapy is. It's not life coaching. I'm not anyone's bestie, although I love besties. I love having besties. What it is, the process is patient-led and patient-centered. I always tell, this is the analogy I use when I see new clients. I'm like, hey, you know, this is your journey. This is your path. You know, you have the flashlight. I was like, while we're walking down this path, I'm going to hold the flashlight for you and just kind of shine the light. And at the end of this path, I'm going to give you your flashlight back, because you're going to be able to shine your own light. So being transparent about what therapy is and what it looks like. I also tell people, like, at any time you're not satisfied with my services, you can fire me. I'm okay with that. You know, my goal is to kick you out of therapy anyway, you know, but if you're not satisfied with the services, you know, and I will help you find a therapist that aligns more, you know, to your needs. I know a lot of therapists do not say that. And I think that that's something that we all should say, like, hey, you don't like me, you can kick me on right on out. You can fire me. It's okay. Usually they'll laugh. And I think I've only had one person who was like, yeah, you know, this isn't going to work, you know, and it's okay, you know, and I helped connect them with a provider that aligned more to what they needed, right? I think the other thing is, like, when you talked about collaboration, that we need to be talking to other mental health providers. Usually we're reading notes, or there's always like the after. I think that we need to be talking and collaborating and kind of building a community around our clients and around our people. I think also we need to address our own wellness journeys. There are providers who are struggling with depression and anxiety, who are struggling with secondary trauma, who are triggered in sessions, but they don't tell anyone. That should be normalized. I've had providers who have came up to me after I've done a presentation about suicide prevention, and they're like, oh my God, I do not like to talk about suicide to my clients, even though they present in there with suicide. It scares me. But having conversations about that. And also, and I know this is like kind of away from the topic, but also talking about leadership roles in mental health care. And what that looks like, and modeling appropriate leadership roles, and encouraging therapists to be in those leadership roles to provide supervision for new and upcoming therapists. I think it's really, really helpful. Yeah. And training. Always, I'm a training girl. Always being on top of training, education, and going back to school without the student loans. Y'all need to work on that student loan thing. But always making sure that you're educating yourself, because there's always something new out there. There's always a population that has not been supported, or a population that you haven't worked with that you need to learn more about.
I love that. I love that you talked about, you know, providers, and that, you know, providers are, you know, they also, their emotions are important too. And it helps them to provide the best therapeutic care for their patients too, right? Taking care of their own mental health. Yes. And I love that you brought that up, because it's so important.
Yes. We need to embrace the humanness in all of us, you know. A true story, and I don't mean to throw my doctor under the bus like this. But the first time I met with my, I've had the same psychiatrist now for a few years, and he's amazing. But the first time like we met, you know, and again, community mental health is a really small little pond. The first time we met, he went on, he was like, oh, you work at Hegira. Hey, do you know this person, you know? And I'm like, wait a minute. Hey, focus on me. You know, but human, whole human. And so I make sure that I set a few minutes, you know, every time we meet for him to ask questions about my agency or ask questions about this or, hey, have you heard about this? Because, and it just helps us kind of align better. It makes the appointments more smoother. It makes it humanize, you know, the process. So yeah, we're all human. We need to embrace our humanness.
I think it also breaks down barriers for people who are afraid to go into get therapy.
Yes.
Because they're so afraid that this is just going to be a robot person. They're just analyzing them and diagnosing them with something.
Yes. I think having the computer, typing away, not paying attention.
The person who's just like, yes, and how did that make you feel? Exactly that. I think it helps with the human side of it, to the humanistic side of somebody to really relate and open up.
Yes, absolutely, yeah.
I'd really like to thank my new bestie, Kelly Mays, for joining us today.
Thank you for having me, bestie.
Thank you so much, Kelly, for joining us.
Thank you, Uncle Mike.
So on this World Mental Health Day, whether it's supporting or advocating, make sure that you're being mindful of yourself, of those around you, and of your community. To find your breaking news and latest updates within the College of Nursing, please refer to our website at nursing.msu.edu. You can also find us on all our social media platforms at MICHST Nursing. If you or somebody you know is struggling with mental health, please see the podcast descriptions for links for support. You are not alone.